Thank you. It's a privilege to be here. I somehow feel that I should be defending Mr. Rogers right now. My friend Sid Mukherjee referred to cancer as being the emperor of all maladies. Indeed, the first mentions of cancer are found on the walls scribbled by cavemen. In the United States, cancer really started to become a major problem around 1900. Epidemiologists love to show things in rates, and these are age-adjusted rates. In 1900, for every 100,000 Americans, there were 64 cancer deaths. And that increased until 1991, when there were 215 cancer deaths per 100,000 people. Fortunately, over the last 25 years, and we have data to 2015, we've had a 26% decline to 159 deaths per 100,000. Again, these are age-adjusted rates. The 26% decline in cancer mortality is attributed, number one, to prevention, especially to smoking cessation and tobacco control. Number two, to improvements in treatment. And interestingly, number three, to screening. Cancer screening is third. At the same time that our national death rate has gone down to 159 deaths per 100,000, it's important to point out that there are significant disparities by race, by education, by region of residence. Indeed, the death rate in Utah is 125 deaths per 100,000. The death rate in Kentucky is 195 deaths per 100,000. Literally 125 versus 195 in two different states. We estimate at the American Cancer Society that there will be 1.6 million Americans diagnosed with cancer this year, and there will be 610,000 Americans who will die from cancer. As I noted earlier, there are huge disparities by education. College-educated Americans have a much lower risk of cancer and cancer death compared to non-college educated Americans in the United States. If the 68% of Americans who do not have a college degree were to have the death rate of those of us who are college educated, instead of 610,000 Americans dying this year, there would be 140,000 less. The disparities by education account for almost 1 in 4 cancer deaths in the United States. Keep in mind, this is not developing a new drug or developing a new surgery or a new treatment. This is simply getting people what we already know every human being should get. This is the power of getting all Americans the prevention that we know everyone should get. This is the power of getting everyone the screening and treatment that everyone should get. It's actually more than 140,000 lives that could be saved because 6% of college-educated Americans smoke tobacco. This is a slide that's a summary by Graham Colditz of what we know in terms of the causes of cancer. With the dramatic increase from 1900 to 1991, it's very likely that if we remove some of the things that caused that increase, we could actually lower the increase more so than it is today. It's our estimate that smoking is the number one cause of cancer and cancer death in the United States. The combination of obesity, bad diet, and lack of physical activity, think of it as a three-legged stool called energy balance, is the second leading cause of cancer in the United States. And indeed, with the decline in the use of tobacco in the United States, is destined in the near future to become the leading cause of cancer. Other things such as hereditary factors, viruses, alcohol exposure, UV and ionizing radiation is important, especially as we realize now that about 2% of all cancers in the United States are due to medical radiation. Screening tests, diagnostic tests like CT. Prescription drugs, reproductive factors, and pollution round out the causes of cancer. At least 50 to 60% of cancers can be prevented. We have today a wonderful group of people here who are going to talk on cancer prevention. I'm going to introduce all four of them, and then I'm going to sit down and let them give a talk. Then after all four have talked, we'll have a little discussion, and then we'll open it up to the room for questions. Dr. Cornelia Ulrich is director of the Comprehensive Cancer Center at Huntsman Cancer Institute. She's also a John M. and Karen Huntsman Presidential Professor in Cancer Research in the Department of Population Health Sciences at the University of Utah. Dr. Kenneth Offit is Chief of the Clinical Genetics Service at Memorial Sloan Kettering Cancer Center, where he holds the Niehaus Chair in Inherited Cancer Genomics. He's a member of the program in Cancer Biology and Genetics at Sloan Kettering Cancer Institute and a professor of medicine and public health at the Weill College of Medicine of Cornell University. Dr. Ernie Hawk is Vice President and Division Head for Cancer Prevention and Population Sciences at the University of Texas MD Anderson Cancer Center and holds the T. Boone Pickens Distinguished Chair for Early Prevention of Cancer. And rounding out our group is Dr. Doug Lowy, the beloved Deputy Director of the National Cancer Institute of the National Institutes of Health. Dr. Ulrich.